What's up, guys? Welcome to another episode of The Fit Couples Perspective. Here with my lovely wife, Terica.
That's me. Lovely.
How
and your
are
wife.
you?
Great.
How are you?
I'm doing so good.
Oh, good. We've got just a gorgeous Sunday afternoon here. Spent all day laying around and excited to be here doing a podcast with you.
You are
guys
excited?
today. Yes.
Oh my gosh.
I am excited, believe it or not.
So, we are going to hold up the mics this time. Hopefully for the people listening can hear us a little bit better. We thought that might help the audio in our
Plus, it looks really cool when we're holding up these Rode mics right next to our mouths. It's always just the right amount of sound for you guys.
Yeah.
Believe it or not, we don't have a professional studio. For those of you that are watching on YouTube.
Yeah, this isn't.
Yeah, this
fake.
is actually, believe it, this is like our house. So
really?
We're just hanging out in our room. For those of you that are listening on podcasts, go check us out on YouTube sometime. You can watch us talk to you here in our studio, also known as our bedroom.
Don't tell them where we're at.
It's our studio room.
It's our studio.
Bedrudio. Here we are.
Okay, are you ready for our topic today?
I'm ready for our topic
But you don't even know what it's about.
I don't, but I'm ready for it.
That's the fun part. Normally with our podcast, we like to keep each other on our toes and not tell each other what specifically we're going to talk about. He doesn't have any idea what I'm going to ask him.
I feel adequately on my toes right now.
Okay, well, let's get right into it.
Let's do it.
You know what? I'm going to preface this with Trainer Mike here has been keeping a secret from everybody. Do you know what
I keep lots of secrets from everybody. Which one are you talking about?
Okay, well, I am talking about your knee issue.
My knee issue.
Yep.
It's not too much of a secret.
Yeah, I guess. But I feel like on the podcast we haven't talked about it. And I think that this is like a really good topic to cover because I think there's so many people in that same position of having an injury and not knowing where to go. Like whether they do surgery, whether they just keep pushing, whether they try to, that's kind of what the topic's about, is injuries and how to get over those. It doesn't have to be specifically your, knee issue, but why don't you tell them all what your big old problem is?
My big old problem is, well, it was probably 6-7 months ago. I woke up one morning and I went just to get out of bed and my knee hurt. And it wasn't extreme pain, but it was enough where I was limping. And obviously I knew I didn't hurt myself in my sleep, but the day before I was pretty active. I'd been, coaching some soccer for our son and just doing some of my other normal stuff, but it just kind of limped on it for a while. And I remember leg day was that day actually. And so I kind of just took it easy on leg day. There were some movements I just didn't do. And that's not normal. I mean, occasionally stuff just hurts. And so you kind of have to modify some things for a while. But I modified some things and it got a little bit better over time. And I actually prepped for my entire last show. I was probably 12 weeks out at the time, prepped for my whole show with this knee hurting. And I had to modify all my workouts. Again, it wasn't really the first time that I had to do it, but things just didn't really get better. I would occasionally try and push it a little bit and then it would hurt again. And then it would get better and then I'd try and push it again. And then it would hurt again and then it would get a little bit better. And I finally got to a point where I reached out to a friend of mine who is a orthopedic physician. I just said, hey, I've had this knee pain that's been going on for 6 months and, just curious what direction you think we should take. He's like, that's too long to be dealing with knee pain. You need to come in. We need to get some x-rays taken and we need to talk about it. So did that, met with a friend of mine, Caleb Redden, and he did some x-rays. And he just
shout out
right away. He was like, you've got a torn meniscus. And hearing those words really sucked because I was like, no, I don't get hurt.
Well, hoping it was oh, let's do some rehab. Let's just a quick fix, basically. I think everybody wants to hear that.
Yeah, you get an injury, you want to be able to take care of it on your own. And so that was kind of where that happened. And it was frustrating to hear that I had a tear. And I was like, well, what's the best next step from here? And he said that dreadful word, surgery. of like, well, if you want to fix it, you have to get surgery. So then I went and got an MRI, confirmed that I've got this complex medial meniscus tear, and now I'm waiting to meet with a surgeon.
You're like a doctor now.
Yeah, it's a pretty big deal.
Meniscus
Pretty big deal.
tear.
You spend enough money on your medical stuff, and you start to, get to know the language a little bit. So that's where I'm at, and it sucks because I have to get surgery if I want to get it fixed.
Okay, so that is kind of where we are at, and you have not gotten it fixed yet, but we're in the I don't know, the world of trying to get a doctor to even like have a surgery planned, or I think that takes a while, especially after 2020. It just like stopped everything. Now everything takes forever. So going into that, so what would you offer somebody that was like having maybe like I feel like shoulder stuff is a huge, like rotator cuff stuff. But just what would you tell somebody that if they were kind of having like issues over and over, kind of exactly like you, like where you feel better, but then you get hurt again? What's your...
Yeah, and I mean, I think like the thing is, back in our 20s, you didn't really get like hurt a lot. Like, I mean, did you ever feel I'm
still in my 20s.
Yeah, feel like you had anything in your 20s that was, put you in a position where you like couldn't work out for an extended period of time or caused you pain, or it's just like... Yeah,
remember my back?
I do. Were you in your 20s then?
Yes.
In your 20s? Okay.
Absolutely.
You had like a back spasm, right? Had to get like some muscle relaxers, but...
No, remember when my back hurts, like I threw out my back. And I was definitely in my 20s. We only had like 3 kids, and I couldn't move
for like a week, right?
It was at least like 2 days that my parents had to come over and watch our kids because it was so bad. But yeah.
But anyways. It was like, but what I mean is like in your 20s, you have those things that like they might bug you for a few days, but it's not anything that like takes you away for an extended period of time.
Well, I've never had an injury, knock on wood.
Yeah, and that's kind of where I was at, like where I was at too. And so I think that's hard because, you have these little things and you try to work through them, and you usually can take a couple days off, go get take some ibuprofen or something, and then you're good to go. But, I think it's like a good idea if somebody starts having pain. And here's the thing, like if you're an athlete, it doesn't matter if you're a bodybuilder, weightlifter, or anything, like athletes, they have injuries.
That's very true. I mean, even our 9-year-old, even our, our son, when we went to, remember we went to Las Vegas, and I don't know if it was an actual injury, but remember he didn't play that.
Oh yeah, his leg was like all of a sudden he just couldn't walk on his leg.
We like drove all the way to Las Vegas, and he doesn't even play in one of the games. Anyways, long story short is that even at like a young age, yes, like
if you're going to push yourself,
injured.
If you're going to push yourself to a high level, you are going to experience injuries. Period. Doesn't mean that you necessarily did anything wrong. Like you always look back and say, I could probably do things better, but. So that's like step one is, first of all, it's normal, to feel some pain or some injuries. Like most of the time, you didn't do anything wrong. You're just pushing yourself really, really hard. But, the first thing you want to do is avoid any painful movements. So any of those movements that cause a lot of pain, avoid those. And most of the time you can find ways to train around it. Like I prepped for a whole show with a torn meniscus, and there's been times like where your neck and your back will like, you kind of get your shoulder blade or ribs or something kind of out of place, and you just change the way you work out, right? Yeah,
but I also have to say, because you've kind of put yourself in this position, is now, is it your other knee or is it that other side of your knee that's like taken over and now overcompensated on one side, so then you can have an injury.
Yeah. So
that's where you have to be careful, because now, what is it? Is it your other knee?
It's just the outside of my knee now that's starting to experience like some unusual wear, probably because I'm trying to avoid the pain that's happening on the inside of my knee.
So you overcompensate on that side.
Yeah.
So that's I guess I'm just putting it out there, like to be careful not to like, okay, my rotator cuff on, like throwing that way hurts, so I'll do stuff like moving it like a different way. I would just suggest not even.
Well, but I think the thing is, and like where I think you're going with it is, that's a short term, okay. It's okay to make some of those things short term. Where it's been like 6 months for me, it's too long.
Yeah.
And so when you experience these things, like one thing I always tell people is you still train. Like if you get a little hurt, people ask me that, they're like, oh, I kind of bumped my shoulder, can I still work out? I'm like, well, you have your legs and abs and, back, all these other places you can train. Like don't just stop training. There's very few circumstances where you should just stop training. But you work around it. So you find movements. Like I love hack squat. It's one of my favorite exercises, and you always give me a hard time for, I'm going to blow my knees out for doing hack squat. I did not blow my knee out doing hack squat, but I can't do hack squats anymore. But I can do leg press. Leg press doesn't cause me any pain at all. So even with the torn meniscus, I can find all these exercises to do that cause me no pain at all. And I think that's what I would recommend for people. Is if you have an injury, just play around with different movements that don't cause pain. Certainly don't continue to push yourself to a point where you feel pain.
Yeah, I would agree.
Like it's different, and I'm not talking like pain like, oh, I worked out really hard and I'm sore. No, like my joint really hurts, sharp pain. Don't do that. Find something else to do. Okay.
Yeah, I get it. And so now you're going to do the surgery. Why are you going to do the surgery when you can feel like it feeling better, if that makes sense? It goes up and down for him. So sometimes it is really bothersome if he goes out and plays soccer with the kids, or if he lifts heavy on his legs or something. It does start like flaring up. I don't know if that's the right word, but definitely starts to cause you a lot more pain. So, but when you don't use it as much, it doesn't cause you as much pain. So why are you going to get the surgery?
You just have to, you get to a point where you realize, I realize this is not going to get better on its own. It's an injury. And if I ever want to get back to 100%, if I ever want to push myself really, really hard again and feel like I have no limitations in my knee, I have to get the surgery. And I hate that. I wish I didn't have to get the surgery, but I have to get the surgery if I want to get back to 100%. So if I don't do it, I'll be fine 95% of the time, but I will always have that reminder that pops up every now and again and reminds me that I've got a torn meniscus. And I don't like that, because I have a lot I want to give life at 100%, and I don't like the idea of not being able to give 100%. So it sucks, because I'm going to have to take a serious step back in my training and to be able to get the surgery done and recover from that. But I know if I ever want to get back to 100% again, I have to do it. And I think that's where a lot of people get stubborn, is they're like, well, I can kind of work around it and things. I can kind of do this, kind of do that. I mean, what really kills me is the kids, like not being able to play soccer with the kids. That part sucks. The weight training, I can work around that, but maybe not hiking with a kid on their back, or not, being able to play soccer with the kids. I don't like that.
Yeah. And I think another added element to why you would get the surgery is down the road. I mean, we're talking 40 years down the road. Yeah. It's going to make a significant difference in how your knee feels in 40 years if you weren't to do the surgery.
Yeah, I think it's one of those things where sometimes you have to take a step back to keep moving forward. Mm-hmm. And again, I hate that, because it's going to be a big step back. Right now, I'm fine. I can go about my daily life. It's going to seriously disrupt my daily life for a period of time, but you do have to keep long term in mind. 6 months from now, if I get the surgery from tomorrow, I should be able to have no pain whatsoever and do all the things that I want to do. But first, I have to go through the pain of surgery to get that done. And some people just, and myself included, you're almost so afraid to just take that step back. But in 6 months from now, I'm going to be like, dang it, I could have been experiencing life fully if I would have just bit the bullet and got it done.
Yeah, yeah. And okay, so let's talk about after surgery. Not obviously your rehab's going to be entirely different than any, a rotator cuff or something with your neck or something with your ankle or something. But what I'm getting at is, what are you going to do differently that everybody can take a little piece out of that? Like your diet, what are you going to do? What are you going to do for all of the things that encompass your life that you do now? I think will change just you are going to tweak it, whether that's you bring your calories down because you're not going to be moving so much, or whatever it is, so that people out there, when they get done with the surgery, when they have something happen to them where it's, you know, that they can't live their normal, like they can't exert as much effort and all of that. So what would be your, what's your idea of what it's going to look like after your surgery?
Yeah, I anticipate eating less food. So I'll probably drop my calorie intake down. Try to, at least, because I won't be moving quite as much. I won't have that same output, but I'll make sure I consume a lot of protein, as much protein as I ever have, because I'll need that to be able to recover. And that'll be a big part of it. I'll try and keep my sugar down, because sugar, you know, can cause some inflammation, and I'm going to try and keep the inflammation down. I'll include the Outlive 100 from Cage, just to get some of those extra anti-inflammatory ingredients in there. So I think I will take that part of it pretty serious, because I'm going to want to get back to activity mobility as quick as I can. And I don't anticipate it taking too long. Maybe I'm getting aggressive, but I anticipate being able to walk around pretty good after a week or two, hopefully.
Yeah. Is there anything else, like what with training? Let's just say it's just a broad, like if you had somebody that had gotten hurt, what is a broad advice that you could give somebody for in the gym?
I would say if somebody's in the gym and they're experiencing some kind of pain, if it's
no. After surgery.
Oh, after surgery.
So, like, what's your advice to people after surgery? And I know that's a very specific to, like, their body type, but an overall advice.
Well, I think you have to be patient with yourself. You have to give yourself some grace and say, I kind of have to start back fresh a little bit. Don't get too far ahead of yourself. Last thing you'd want to do is re-injure yourself. So to kind of take it slow, take it easy, use that opportunity to rest up a little bit, and gradually work your way back up to where you used to be. Because you don't want to rush that process. You've got time. We've all got time in that scenario. As eager as we might be to get back to it, I think it's super important that you take your time, you do things smart, because that's going to make a big difference in how you recover and getting you back to full function as quickly as possible.
You know, I just thought to myself, I was like thinking like, oh yeah, I like just never have been in like an injury position of like just taking a step back. But then I realized I've done it 6 times. I mean, really, truly, like it's more than I feel like it's more than a step back, because it's 9 months of literally gaining weight that you have to gain, and then having to like lose it after, and like getting back in the gym. It's definitely a slow, like I would try to run a couple of times like after I have had babies, and it's like your body will tell you literally, it'll be like, no, like you can literally feel it in your body, like, no, it's not a good idea to be running right now. Even if it's after like the 6 week mark. I always tell people that. People are always like, ask me questions about after I had a baby, and I feel like it's so like particular to your body that I can't give you, like, I just think that 6 weeks advice is like really like outdated, in my opinion.
It's very generic.
Yeah, because I feel like I can go back and do a lot of the things in the gym that I could do like right before I had a baby, or right after, or like right before I got pregnant. But then there's some things that take way longer than 6 weeks that I would never advise anybody to do, even after 6 weeks. So how
do you stay motivated during that time when you're
that is freaking hard, actually.
Even during like that 6 weeks when you're like, okay, I can't fully exercise, but I'm kind of moving. I mean, how do you stay motivated to do anything? Well,
I am like a huge fan of going to the gym your whole pregnancy, and literally like as soon as you feel like comfortable to, like, if you want to, like, if I know most women, or some women, are nursing, so that obviously plays a part in it, but an hour away from a new baby isn't going to be, I feel like, in my opinion, it's fine. In my opinion, I was always fine leaving the babies with you for an hour, and I went to the gym. I think it's a huge help for what is the depression called after you have a baby?
Yeah, postpartum
depression. I think it's such a huge thing for women with postpartum, to get out and like move their body, whether it's even in their house. Like there was many times where I wasn't able to go to the gym, and I would put the baby in a pack and I would walk on the treadmill. And I think it's just like doing the things that you normally do, and obviously you can incorporate the baby with with that, but like keeping your schedule, your routine, even with like you get your knee done, I think that you could still go do mobility exercises when you would normally be at the gym.
Mm-hmm.
So you like keep the routine in your life, regardless if you can't even move that leg. You're like doing bicep curls.
I'll be in bed doing bicep curls.
That's what I mean, is like, I think just keeping the routine was my biggest help, even after I had the baby and while I was pregnant. But staying motivated while you're pregnant is the hardest thing, I think, in my opinion, because you have to gain the weight, and you know it, you're going to continue gaining the weight the entire time. You can't stop that, and you have to, that's a normal part of pregnancy. And it's hard to like wrap your head around that when you have like, are always trying to like not lose weight, but you're always trying to stay like relatively in the same weight.
I think a big thing I picked up off of what you just said is just how important it is to stay in the routine. And, I saw you do that. I mean, even if it's, you're not your perfect workout, but
no, for sure,
you're going to go in there and you're going to keep that routine, because when you stop going to the gym and you stop, making that a part of your daily schedule, that can be really hard to get back again. And that's probably just really good advice for anybody pregnant, injury, somebody going through just any kind of transition that pulls them away from their regular activity. Being able to keep that consistent routine sounds like it's been a huge help for you in that, and definitely something that I'll try to take as advice as I try to recover from my bum knee.
Yeah, I definitely, it's definitely the best advice that I think that I can give. Even I remember being so sick and like even going to the gym and not literally being able to do but 5 things, and being like, oh my gosh, I'm gonna like be so sick the entire time. But the fact that I was still going, it just like never got out of my schedule. So it was never a problem when I did feel better. I wasn't like already staying home all day and then being like, oh, now I'm gonna have to start going to the gym again because I feel better, because I already was.
Yeah. So. No, I think that's great advice.
Yeah.
I like that.
Yeah. Well, now you know Michael's secret.
There's my secret. There's my secret. No longer a secret. I think
that this podcast it might not like be for you right this moment in time, but I think every person listening out there that's in the fitness realm is going to deal with some kind of injury or pregnancy or whatever at some point, and this podcast will definitely come in clutch for you. Do you have anything else to say?
No, that's it. Let's go. Let's do what we got to do. Keep moving forward.
Yeah, we'll let you know when he gets his surgery done. I'm sure he'll
record
do great.
7 podcast episodes those 2 days.
Yeah,
we'll have
for
all
sure.
the time in the world.
Yes. Okay, we'll see you guys next week. Talk to you later.
See ya.